Good evening, everybody. First of all, I would like to welcome you to the European University of Cyprus. My name is Zoe Dorothea Pana, and I'm a lecturer in pediatrics. So as you can see, we can start now with our next session, which is about health and safety. The title of my presentation will be Best Practices, Best Safety Practices for you as medical students. And I will start with that slide because currently probably you have heard a lot about safety and infectious diseases. And as you see here, infectious diseases, outbreaks, as well as pandemics, have been a constant companion of human beings. So it is something that you should be aware of and keen on. And if you see closely, during the last approximately 10 years, we had 3 outbreaks attributed or connected with coronaviruses. So that means that we will have to deal now, but also in the future, with similar infectious diseases outbreaks. And it's not only about that. If you see here on the slide, this is a review from WHO, which says that until 2050, we will have to deal with an increased rate of deaths that they will be connected and attributed to infectious diseases, and specifically to bugs that they are resistant to drugs. That's why antimicrobial resistance. So, it's very important for you as medical students, but also as future physicians, to know the best practices, how to protect yourselves and your patients against these outbreaks. And on this slide, you see a very nice book, which is called The Art of the War. When I read this book, I felt like that this is the ideal book to read and learn how to combat outbreaks and epidemics. And if we actually say that the infectious agents are our enemies, then as it says here, if you know very well your enemy and yourself, then you don't need to fear the result of hundreds of battles. So the first thing for you as medical students to do is to know your enemy, to know very well with what you deal with infectious agents. And the first thing that you will have to keep in mind now during the COVID pandemic, but also in the future, is the chain of transmission for every infectious agent. And you see here on the slide, you have to know the germ. You have to know how it is actually transmitted from one person to another. You have to know how the bug gets inside our body and outside our body, and what is the susceptible host. And what are the 3 main weapons of infectious agents? Invisibility. We don't see them, but they exist everywhere, both in the community and in the hospital setting. Adjustment to environment. You know that. Actually, antibiotic overuse is also something that we change, and it has a huge impact on infectious agents. They can adjust very easily. And the most important thing that I would like you to remember in your future careers is about transmissibility of infectious agents. We do have outbreaks also inside the hospitals, not only in the community. So for you, as medical students, the advent of outbreaks. And of course, you saw it also nowadays with the COVID-19 pandemic. It's not easy. So preventing infections is really exhausting. But on the other hand, battling an outbreak or an pandemic is even worse. So again, what do we have to do as medical students at the university, in the hospital, in the community? Break the chain of transmission. This is what I want you to remember. Break the chain of transmission of every infectious agent, including now COVID-19. How? Back to basics. You will hear it, you know it probably, most of you. You have to protect yourself and you have to protect your patients with very easily implemented measures. First of all, in the healthcare setting, you see here again from WHO an infographic. What it says here, and I want you that to remember, is that we have to deal with preventable harm as far as infectious diseases outbreaks is concerned. So what I want you to remember, first of all, is that you have to learn to wash your hands properly. Easy thing to do, but we don't do it as medical students, as physicians. Please learn to wash your hands properly according to the WHO guidelines. And as you can see, if you are compliant to that, we might reach 50% reduction of outbreaks and infections inside the hospital setting. And of course, we have to be together as a team. We have to know that these prevention measures are important and we have to collaborate. These teams do prevent infections in about 30%. But not only in the hospital setting, also in the community, you have to do the same as medical students. You have to protect yourself and you have to protect your patients and your family. Here, apart from these protective measures, don't forget vaccination. And my last slide. We are currently during an outbreak, during a huge outbreak, during a pandemic, COVID-19. This will be for you a school. You have to learn now about the best practices, about these preventive measures that you will have to follow both in your personal life, at the university, in the hospital. You know that you have to avoid handshaking. You know that you have to avoid crowding. You know that you have to avoid face touching. You know that you have to clean your hands properly and very often, and it is your duty as medical students to play a role for the community now. At last, it is important for you to report if you have any kind of symptoms to us. We are now your family and we will support you. And the last thing that I would like to wish you is to enjoy your beautiful journey of medicine. I'm pretty sure it will be very interesting, but most of all, you have to be careful. So enjoy the journey with safety measures. And now, finishing my lecture, I would like to introduce the next presenter, who will be Professor Konstantinos Ekmezoglu. He will talk also about best practices. Good luck.
Dear friends, welcome to the 2020 orientation week for the medicine and dental students. My name is Dr. Konstantinos Ekmezoglu. I'm a consultant gastroenterologist and I'm a lecturer at the EUC. It's a great privilege to be for me to be with you today. I know circumstances could have been different, but in either case, I will hope to see you again face to face really, really soon. So today we're going to have a short 10-minute presentation about basic protective measures and social distancing in the COVID-19 era. I know we've heard it before, so I won't go into details, but I think that it's really, really important for you to understand the basic concepts of basic protective measures and of social distancing in your everyday life, either at the homes at the towns you're in, or in the home you are in, or at the EUC campus. So let me share my screen. So I chose to have a WHO, the World Health Organization, as my reference point because it's an easy access internet point where you have lots of information about protective measures and social distancing. So I advise you, whenever you have time, open the WHO webpage and see all the necessary drawings, illustrations, and guidelines. So first of all, you have to know your facts. Okay, and we know by now two facts regarding how COVID-19 is spreading. First of all, COVID-19 is spreading primarily from person to person via droplets. Okay, when someone sneezes or coughs, droplets can land on the mouth or nose of people nearby. This is why we are very strict on close contact. Okay, COVID-19 can be spread with close contact with someone who is sick, like when you do hugging or when you do shaking hands. The second thing we know about COVID-19 and how it's transmitted, it's it can also be left on objects and surfaces. The buttons of a lift, your laptops, your mouse, doorknobs, pens. So if you touch something that is possibly contaminated, you may get a chance of being yourself contaminated, and then you may fall ill due to COVID-19. So these are two really, really important things you need to know, and I'm sure you already know by now. So again, the reason we are doing this presentation is because you're citizens of the world. So you may live in a small or in a large area near or around the campus, but your microcosmos is EUC campus. So we have to take care of how to implement what do we know about basic protective measures and social distancing, not only in your house, but also in your workplace. And for the next 6 years, your workplace will be EUC School of Medicine. So what happens in urban settings? What happens at your homes, in your neighborhoods, or when you go out? So if you're at home or at a public place, avoid touching your eyes, your nose, or your mouth. This is really, really important. When at home or when you're outside, follow the golden rule. Wash your hands frequently. Either use soap and water or an alcohol-based hand rub. If you have fever, cough, or experiencing problems with your breathing, seek immediate medical care. Okay? So times are changing. We do not just sit home with a flu and waiting for the virus to go away. Sorry. When you're at home, okay, when you cough or when you sneeze, always discard the spoiled tissue into a proper basket. Needless to say that some of you may be living with others, so it's really, really important. When you're using the public transportation means, okay, stay at least a meter away from anyone who's coughing, sneezing, or has fever. When at home or where you're amongst other students, when you cough or when you sneeze, cover your mouth and nose with flexed elbows or a tissue. If you use a tissue, dispose the tissue. If you ever experienced any kind of medical signs and symptoms like cough, fever, or you have difficulty in breathing, always wear a mask correctly. Always seek medical advice. Now, this happens when you're at home, okay? And most probably, and preferably, it should happen if you are living alone. However, your microcosmos, as I said before, is EUC for this semester, and for the semesters that will be coming. So we have to keep safe in the new normal. We have to learn how to be safe in our workplace. So there are simple steps that can lead to staying healthy and taking care in our workplaces. First, physical distancing. And I'm very proud to say that EUC has done a lot of things to fully comply with all national and international guidelines. So not all employees should come to work. Seatings at workstations and common places have been rearranged. EUC encourages teleworking for his employees. The need for physical meetings has been minimized through teleconferences. And of course, any workplace event and social gathering has been postponed. This is the principles of physical distancing in your workplace, in your work environment. The other important thing that we have to do, and when I say we, I mean all us, EUC members, staff, faculty members, and of course you students, is to take care to spread the word of the virus, which is at each possible moment, EUC will provide you with informations, videos, or posters to increase awareness of COVID-19. We will share regular updates about the risk of COVID-19. I'm putting an asterisk here. Only trust authorized sources like WHO. Don't be caught up in this internet whirlpool of things and information that is coming your way. We have considered having an isolation room and personal protection kits ready at hand if in case that anything happens. Okay, and there is a plan that all medical staff and experts are on campus, are close by, are standing by whenever there's a need for a patient having this kind of symptoms. EUC has fully complied with local governmental health guidelines. So is it business as usual? Not as usual, but we try to do it in the most effective way. So offices have been opened in a phased or stepwise manner so that safety is maintained. If safety is an issue, then we do not proceed. And this should be a rule of thumb for everyone, each and every one of you. When you're working where you're in your workplace or at the EUC campus, sanitization, really, really important. So we have installed hand hygiene stations. We have made sure there's the adequate supply of hand wash soaps, tissues, dustbins. Daily, this disinfectants, and now every course there are at this workplace is sanitized, is disinfected. Of course, we do our course in such a manner that we avoid crowding. We avoid either us, people involved at EUC in the EUC learning experience, or EUC academic staff, or you. We avoid that we stand together either in queues, at entrances, or exits. This is really, really important. And of course, always respect social distancing. Always respect the at least 1 meter rule. We are, as EUC, really, really strict on protecting staff that have pre-existing medical conditions or are above 60-year-old. We always comply fully with local guidelines. That means that every person inside EUC campus, closed doors, has to wear a mouth and nose. And I'm signing off with a small video. It's from WHO. And I think that since we all feel like children, at least I do, I think it's a 1 minute video. I think it's really, really helpful. So if we have these basic principles under consideration, the risk of being infected is minimal, is kept to a minimal, and on the other hand, we can get with business as usual, or at least something that is considered normal in our days. So keep calm, because this could be the beginning of a beautiful friendship. Thank you for taking the time to being here with us, and I hope we will see you soon, see you soon, and discuss all these different topics in close contact. Thank you, and take care. Let me. So again, thank you. Stay safe. Please respect international and local guidelines in regards to COVID-19. I wish you all the best of start at EUC. Thank you.
So, hello from my part. I am Konstantinos Tsiotis. I am an assistant professor of internal medicine at the School of Medicine of EUC. I'd like to welcome you all again at our university, and I will talk to you about the current guidelines related to traveling within the context of this COVID-19 pandemic. So, when we talk about traveling, mainly we refer to highly risky, let's say, uh, activity, because traveling is highly risky because, first of all, we go into crowded places or closed places, including the airports and the airplanes, but also we have a lot of contact with other persons. Therefore, we need to apply our own personal protective measures. And the other thing, as you can see in this map from the World Health Organization, which is actually an interactive map, and it's a dashboard and it changes daily depending on the epidemiological condition of every country that reports to the WHO. You can see that different countries have different epidemiology of COVID-19, of the virus actually. So the risk of traveling to and from each country varies, changes, and changes through time. So this is also from the WHO that actually shows us the daily and the cumulative, that's the total number of confirmed cases in their different geographic regions, as you can see with different colors. For example, the continent of America has the highest toll of confirmed cases worldwide, followed by Southeast Asia and then Europe. However, these are just numbers, either daily or cumulative. We have other epidemiological indices that we use when we want to evaluate the risk of each country. Now, I told you that we go into high-risk places, to crowded places, including an airplane. Now, has there been confirmed in-flight transmission of the virus? And if yes, to what degree? This is, for example, a blueprint of an airplane. It's from a recent study that was published in the Emerging Infectious Diseases Journal of the CDC, of the United States CDC. Only few reports have actually confirmed in-flight transmission of the virus from a positive case to others. And why is that? If we think why that is, we will realize that, first of all, there's a lot of screening taking place either before traveling or after. So even after traveling, this screening process protects the travelers, because if I know that I have been exposed and I need to stay in isolation, I will not travel. Or if I have symptoms, I will not travel. Therefore, it's very decreased. Another reason is that nowadays, with the new rules and regulations, planes have a very, very high rate of air exchange, right? They completely exchange their air inside the flight every 2 to 3 minutes. So this decreases the opportunity for any virus to travel through the air to another passenger. And the other thing is that most airlines mandate that everybody on board wears a mask at all times. Therefore, this also decreases person-to-person transmission. So is in-flight transmission of SARS-CoV-2 possible? Yes. Is it likely? No. The answer is no, and according to some data, the possibility of transmission is around 1 to 4,000 or even lower. So you realize how low it is. However, still we apply measures, and these are what protect us. Now, country risk. How do we assess country risk in Cyprus? We have a dedicated team of epidemiologists who review on a daily basis different epidemiological indices that I will show to you from more than 150 countries. This is a dynamic list. It changes daily, right? It depends on the changes of these cases and the other indices that I will show you right after. And they also report on a weekly basis to our Ministry of Health, along with recommendations on where each country should be categorized based on the risk, which I will again show you. Now, these might appear familiar to some of you, or they might appear a bit difficult, so I will not stay here, but you see how many different parameters we take into consideration for each country in order to evaluate their risk. You see, we include the very popular now, the efficient number of reproduction, RT, diagnosis, prevalence, number of tests per inhabitants, mortality rate, which is also an indirect index of, which is also, sorry, something happened with my Skype. Trying to fix my Skype now. I don't know why I was logged out. So I think now you can hear me again, I hope. Good. Sorry for this. So as I said, we detect different, we use different indices. One of them also is a classification by the World Health Organization. And finally, we have a very rigorous process where we test travelers that arrive at our airports. Cyprus has two airports, the Larnaca and Paphos International Airports. So we do random sampling of flights that arrive there. And based on this, we also have a positivity rate of the different these different flights, and we combine that with our different indices, and this leads to recommendation. And actually, we have assessed, we have evaluated whether these random samplings in flights are correlated with the epidemiological situation in these countries, and there's been actually a correlation. And sometimes this also acts, let's say, predictively. We can predict which countries will start having an increase in their cases, and therefore we can apply additional measures. Now, categorization. Cyprus places all countries into three categories, okay? Category A, B, and C, based on the risk assessment that is derived from these indices that I showed you. Right now, category A, that's why I put the green number, the green color, is considered low risk. At this point, consider that it has a similar epidemiology with Cyprus. And what does that mean? It means that passengers that come from category A countries are not required to do a test or self-isolate. So it's as if they're traveling inside their own country when they come from category A. Category B is the yellow color, let's say. It's still possibly low risk, but it's a bit uncertain. Maybe some of these indices are beginning to worsen, deteriorate, and therefore some caution is needed for travelers who come to Cyprus from these countries. And category B means that someone coming from there needs to have a negative laboratory test, a molecular test, a PCR test that is negative within 72 hours before arrival to Cyprus. So someone who comes from a category B country, they need to have a test within 3 days before coming to Cyprus and present this test, this certificate, showing that they were negative upon arrival. Category C in red is considered high-risk country, right? It includes, it's a biggest list. It includes all countries that are not in categories A or B. And what does that mean? Someone who comes to Cyprus from a category C country has to fulfill certain uh, indications. It's not allowed for everyone to come to Cyprus, but they should be either citizens of the EU or Cyprus, or have a relation with Cyprus, let's say a work-related, or be a student here, right? They can come under these circumstances. They need to have a test upon arrival, right? That is negative, and regardless of that, they need to stay in self-isolation for 14 days. Why? Because we consider them as coming from a high epidemiologically active country, right? So they need to stay in self-isolation regardless of their PCR test upon arrival for 14 days. And at the end of the 14-day period, they do a new test. Why is that? Because we have detected some persons from category C countries who have had a positive test right before their isolation ended. So unfortunately for them, they needed to stay in isolation for longer periods. Now, some tips. These are all available for you. Some tips before traveling to Cyprus. First of all, you get informed early. What's the local guidance? What's the categorization of my country? Is there anything else required? As we nicely heard right before from Dr. Ekmekzoğlu. You need also to register to a specific website, the Cyprus Flight Pass, right? Where you just complete some personal information, where you're going to stay, where you come from, whether you're bringing a test with you or not, all these things, some contact information and close contacts information. Now, another tip is to apply personal protection at all times. You're going to travel through crowded and closed spaces, so you need to protect yourself. You don't want to be exposed to any positive case. So try to keep your distances, especially in queues inside the airport. Keep a hand antiseptic with you at all times to perform hand hygiene often, especially when you touch high touch surfaces, commonly touched surfaces. Of course, have a mask with you, more than one mask, because sometimes you need to change them. They might get dirty, they might get destroyed. And also you can have antiseptic tissues, or even the hand antiseptic can act in this way to clean any surfaces that you might use, for example, in the airplane. Okay, and after your mask is either dirty, destroyed, or after you leave the airport, throw it away if it's a single-use mask, or keep it stored safely in order to wash it later appropriately. Personally, I use single-use masks in airports when I travel, and as soon as I leave the airport, I throw it away. Now, after arriving, first of all, we talked about the categorization. We have some links also to give you about these measures. Now, after you arrive to Cyprus, a general recommendation that also comes from the Ministry of Health is to stay at home if you can, at least for a few more days, right? This could be 2 or 3 days, 5 or 7 days. Why? Because you need to be a bit vigilant in case you develop symptoms. Now, in case you develop symptoms, you need to stay isolated, of course, and immediately contact the doctor. or your personal doctor or a doctor anyway. So this is something that is going to go on from now on in Cyprus. Anyone who presents with COVID related or COVID suggestive symptoms needs to stay isolated and contact a doctor. Okay, and this also applies to all of us during winter. It's very important because there's been a lot of cases where people had even mild symptoms, right? Maybe just some fatigue and low-grade fever, and they were circulating like nothing happened with no medical attention, and they actually spread the virus. So we not want to avoid that. You know the symptoms, the most common or most suggested symptoms. We don't need to get into detail about that now. And these are some useful links. Okay, there are specific links, and you can see our PIO, the Public Information Office of our government, has a whole list of instructions and recommendations and information on their website. Right? Their website is www.pio.gov.cy/coronavirus. This is the main, but even if you just Google PIO Cyprus coronavirus, it will take you to that website. We have links with protocols for travelers in English and Greek. We have information on how countries are stratified, how they are categorized, and this is updated weekly. So before you travel, also check this website, check to make sure where your country, in which category it is classified, and when that will start, because it's a weekly update. Thank you very much, and this is my email. I'm available to you if you need any information, either when you travel or anything related to the coronavirus pandemic. Thank you very much.
Good evening again. This is the last presentation of the health and safety session. As you know, per schedule, this was a presentation of Professor Theoklis Zaoutis, who is currently ill. So I will do his presentation. The title is Understanding Your Role as Future Physicians in Infectious Disease Outbreaks, a very important issue. I start again with the same slide about pandemic and the history of pandemics. And please don't forget that outbreaks are a constant companion of humanity. But why? What are the lessons learned from COVID-19 that could actually help us to play an efficient role as future physicians in the future? First of all, what we've seen from COVID-19 pandemic is the zoonotic transmission. That means that an infectious agent, a virus, SARS-CoV-2, was transmitted from animals to humans. The second thing was that it was very easily transmissible to the whole world. That's why also called pandemic, not only in the community, but also in the hospital setting. The second lesson learned is the impact of us, of human beings, in epidemics and ID outbreaks. So what can we say now? What are the data that we have regarding the present pandemic that could help us as future physicians? So the outbreak of COVID-19 provides us strong evidence that urbanization and globalization have changed the way people live, that advances in transport communications have led to a rapid spread of ID diseases, that the increased density of people in residencies have increased the possibilities of viral and other infectious agent transmission. What else? Social inequalities lead to higher risk that generally have and produce a weaker health system. And of course, at last, that poverty contributes to disseminating epidemics and outbreaks. We have to keep this evidence in mind also for the future. And according to WHO, we are currently at a new era, which is called the pan-epidemic Anthropocene. So it's actually a difficult word to understand, but you have to know the meaning. It's easy. It refers to all these kind of multifocal, large infectious disease epidemics that are related to human forces that have impacted in a way the balance and the homeostasis on Earth. What are these human forces? Again, urbanization, globalization, industrialization, growing population of humans and animals. And what can we do as future physicians about that? There is already an initiative from WHO, which is called One Health. What is One Health? It is about everything on Earth, that everything is connected. So as you can see here, healthy people, healthy environment, healthy animals are the three main pillars of One Health. Everything is interconnected, and humans should respect their environment and animals. So the goal of One Health is to prevent diseases that pose a threat to the health of people and animals, and also, in a way, prevent economic disruption that accompany actually these disease outbreaks or pandemics. And here is some information for you that I would like you to remember. COVID-19 outbreak is not new. We have a lot of zoonotic transmissions of infectious agents from animals to humans. And according also to my previous session, I told you that infectious agents have high adaptivity. They adapt to the environment. Whatever we do on the environment, on these balances, might have an impact on us. What is One Health? It is about coordination. It is about communication. It is about collaboration. Everybody, and I mean us, the future physicians, we have to collaborate in order to combat any future outbreak. Lesson 4, we have to present also the positive things. So COVID-19 pandemic offered also some, let's say, opportunities. So what are the new opportunities that the pandemic offered to us, to the humanity? The pandemic displayed examples of solidarity in the local communities. The pandemic allowed sharing resources, information, and expertise from all over the world. The pandemic led to joint forces among the scientific communities. And at last, universities have played also a role with medical students. They offered help in any way with relief efforts. Any kind of help is needed during a crisis, during a pandemic. This is unique and this is positive and happened during the pandemic. And at last, it's also a reminder for us as physicians, that we have to be well prepared for the future. So you will hear eventually during your studies about emergency preparedness, outbreak emergency preparedness. We have to be prepared. We have to be well informed. So the last lesson is emergency preparedness, and this is how I want to close the session. This is a new opportunity for all of us. This is an opportunity to invest more in science, public health, education in infectious diseases. Emergency preparedness means that we want to reduce health, economic, and social impact of future epidemics. Means that it's a global opportunity for the humanity And actually, it's a way to improve us as physicians, but also to keep a balance on Earth, on the environment. Thank you.
Welcome once again to the afternoon session of the Student Orientation Week. On behalf of the Dean, I will be speaking and discussing the importance of GPA along with the academic support services. One of the things that I have learned in medicine very, very early is that every day counts. Every single day in our life counts. Even your first year counts. And all the courses carry a significant proportion and portion of your grade that you will carry with you for the rest of your life. The other thing that you need to understand is that despite the fact that the grade is just a number, the grading of your degree especially is something that you will be carrying with you with the rest of your life, and it will most probably demonstrate to your future employers your ability to practice. So this leaves you with confusion and questions about what is the GPA system and what is the grading system of the university. Here you can see the grading system of the university, and you see that we've got grades ranging from A to F. Each grade represents a different percentage, it has a different meaning, and it carries a different grade points. So for example, the grade A is given to students who've got a 90% or above in a course. The meaning is excellent, and these students receive the full GPA, which is 4. B plus is 85 to 89, and they carry a GPA of 3.5. You need to know this grading system, and this grading system is going to be attached at the end of each course outline. What you need to understand is that there is a cutoff point. We have passing grades and we have grades that are failing grades. And you will see that the passing grade for this university is C. This gives you a percentage in the course of 70 to 74 and the minimum GPA, in order to pass, which is 2. D plus and D can be passing grades despite the fact that they don't give the full GPA, but they give 1.5 or 1, provided your overall GPA, as I will explain later, is above 2. So, in order to be safe, you need to consider that everything above C is a passing grade. Now, the grade points that you have seen on the table, it's nothing more than a way of the university to understand their standing at the time of graduation. And the GPA is nothing more than the grade point average. So in reality, when we're speaking about the GPA, we're speaking about 3 different things: the grade, the point, and the average. And how do we calculate the GPA? The GPA is the way in which we convert letters, for example, A, B, C, to percentiles or numbers from 0 to 4, with 0 being an F grade and 4 being the A grade. So, if, for example, you have 5 classes in one semester, and in your 5 classes you receive, in all of your 5 classes you receive 5 A's, your GPA for the year will be 4. If you receive 5 B's, your GPA will be 3. If you receive 5 C's, your GPA will be 2, and so forth. And you need to understand that because it is normally impossible for any student to receive all A's or all B's or all C's, what we are doing is that in reality we are calculating the average GPA per semester and per year. And in order to find your average GPA, you simply divide the number you receive by your classes. So if you've got 5 classes, for example, and you've got a GPA of 18, the only thing that you need to do in order to find your average GPA is to divide 18 to 5. The cumulative GPA is another element of academic performance, and it is the overall GPA of all the courses taken at a specific time in your studies. So the cumulative GPA changes from year to year, and your final cumulative GPA is calculated at the end of the 6th year. So you need to understand that despite the fact that the first semester might not have too many medical courses, or what you consider to be medical courses, but I've already explained the significance of the basic sciences, you need to understand that you will be carrying your GPA alongside with you for the whole of your life. So it is important to maintain your GPA even from day one. And the GPA defines what in medicine we call academic studying. And in reality, we have 4 types of academic studying. The first type is the good academic standing. The second type is the good academic standing with some type of warning. The third is academic probation. And finally, is academic suspension and dismissal. Now, in what is a good academic standing? The definition of a good academic standing is the minimum GPA required to maintain a good academic standing is a passing GPA. And the passing GPA is above 2. Above 2 GPA is required for you to maintain your status of good academic standing throughout your studies, but also a GPA of 2 is required for you to graduate. Students who have borderline GPAs, despite the fact that they are in good standing, and by border GPAs we mean GPAs between 2 to 2.2, they will need to meet with their academic advisor, because these students show that they've got problems and they need to be addressed. A student can also get what we call the probation letter, and the situation for that is called academic probation. And the academic probation is a letter, let's say a letter of warning, which is sent to the students when their GPA falls below 2, and as a result, it is not a passing GPA. You will be, if your GPA falls below 2, you will be placed in academic probation. You will need to discuss with your academic advisor, and you will need to see why you have failed to achieve the minimum GPA required for you to graduate. And finally, once you meet with your academic advisor, you are going to sign the Strategy for Success document, which is an internal document of the School of Medicine, which defines the ways for you to improve your GPA. Consider this as a plan, and this plan has 2 parts: the part of the advisor, the role of the advisor, and your role in order to improve. Both roles are equally important, and student success is dependent on the fulfillment of both roles. There are several ways and several reasons why someone may fall into academic probation. And we have seen it, and I do remember the dean describing the situation of a student who was under probation because of personal reasons. And these students managed to graduate, and in fact, he presented his thesis in an international congress. The first problem that the students face when they enter the university is a transition, because suddenly you have to move away from being a student at a high school to a medical student. A medical student, as I have told you already, is the student who is able to make constructs of knowledge because it is impossible to memorize everything. So maybe this transition from your high school life to the academic life can play a role. The other important element is the lack of preparation. And the lack of preparation is not necessarily the fact that you are not studying enough, but it may be the fact that you are not studying efficiently. You also need to know that each student has its own times. This means that the time each student has to dedicate in order to achieve his goals in the School of Medicine is different. The other problem is that the student may not be using all the available resources. Some students just use the lectures, which are not enough. Some students use the textbooks, which again are not enough. Poor decisions. You may think that, okay, I will not do very well in biochemistry because what am I going to do with biochemistry? But if you fail biochemistry, this failure will be carried along to the rest of your academic career. And in the majority of the cases, the problem lies with personal issues. We are human beings. We come into problems. Do not let your personal issues interfere with your academic performance. We are here to listen carefully to your personal issues and try and sort them out. So, if for any reason your academic performance is under probation and you've got a GPA below 2, you are off the probation once your GPA goes again into the passing grade, which is 2. Unfortunately, we have students who fail to augment their GPA despite the fact that they've got their academic probation. And we are forced to proceed to the final option we have, which is the academic dismissal. The academic dismissal is always overseen by the office of the dean, and it is determined by the cumulative GPA, which is reviewed at the end of the spring semester. When are you in danger of an academic dismissal? You are in danger of an academic dismissal if your GPA is below 1.7. The school will do everything, first of all, to help you not to get there. But in case you get there, the school will do everything in its power to facilitate transition to another program. But other than all these warnings, we do reward students who do well. And for this, we have the so-called Dean's List. What is the Dean's List? The Dean's List is a list of students who have achieved high GPAs and they are given first, second, or third honors. A student who receives a first honor is a student whose GPA is between 3.85 to 4, the second honor between 365 to 3.84, and the third honor between 3.5 to 3.64. So in reality, you see that the Dean's List rewards everybody who has a GPA more of 3.5. The Dean's List is an achievement, and it is something that's important, and it counts significantly on your CV. I know that this system can be frustrating, and I also know that coming from different backgrounds, you may have difficulties in understanding and fulfilling the road ahead. But I want you to know that you are not lost. We are here, and there is a support system here ready to help you. And this system is the academic support and guidance system of the School of Medicine. And I would like to discuss a few things about the three types of advisors you will encounter in your life, in your academic life. The first type of advisor is the student advisor. The student advisor, I will explain later what a student advisor is. He is an administrator. Then you've got your academic advisor, and then you've got the clinical advisor. Let me elaborate a little bit more on what a student advisor is. The student advisors, as I have told you, are administrators. You've met some of them on day one. Maria Zalti, Iraklis Chrysanthou, Christina Colazzi. Those are people who are working at the office of the registrar. These people issue documents, issue transcripts, and they are responsible for the student verification. So whenever you need an official paper, you will receive it from the office of the registrar and the student advisors. The student advisors are also responsible for helping you getting a student visa when you when it's required. They also monitor your GPA, and they are responsible for the registration of your classes. So these people inform you when you should register for your class of the next semester. You see these people here. You have already met them. Maria Zalti, Iraklis Chrysanthou. Maria Zalti is for medicine. Iraklis Chrysanthou is for dentistry. And for the international students, we have an additional administrator, Christina Colazzi. But other than the administrators, we have academics. And the academics also help you in finding your way around medicine. Who are those people? Those people are full-time faculty. So they hold a tenured track position from lecturer, as I have told you before, to the rank of the professor. Each one of you is assigned to a different academic advisor, as I'm going to show in my next slide. And normally the academic advisors work with the students for the first 3 years. Because when the first 3 years elapse, and we call those 3 years the preclinical years, then the student is assigned to a clinical advisor. The role of the academic advisors is not decorative. So we are not there for decoration. We are there to develop your own personal educational goals. And we are there to assist you in developing and achieving those goals. We also make sure that you are aware of the policies and procedures of your academic life. And you are required to see the academic advisors when you receive letters of warning, probation, or dismissal. But my personal advice is that you meet your academic advisor at least twice a semester, irrespective of your performance. You will receive those in your personal emails, but you will see that each member of the faculty, even me, we are assigned to students with a different surname. So, for example, Theodoros Litras is assigned to students whose surnames start from A, B, and C. I have R and S. This applies for medicine. For dentistry, you have academic advisors who will be allocated to you at the beginning of next week. But as I have told you, medicine is not only the university, is not only the campus. 3 years of your profession, of your student's life, it will be spent in hospitals, and there you will need your clinical training advisors. These people have to have specific characteristics. Again, they're full-time faculty, and as a result, they are people who have tenured track positions. And again, each student will be assigned to a clinical training advisor who will be able to monitor his clinical training performance throughout the clinical years from year 4 to year 6. There is no difference between the academic advisor and the clinical advisor regarding their roles in the fact that both ensure that your educational goals are achieved and your GPA is maintained above 2.0. The difference, however, is that the clinical advisors may offer advice on how to even improve your professional behavior, which could improve your grade and performance in the clinical setting. Thank you. We are going to go on now, and we're going to discuss in a little bit more detail what is the so-called team-based learning, and why do we emphasize so much on the TBL model, on the team-based learning. First of all, I want you to see some pictures. And these are pictures from students. And you see that these students all work together. But I want you to notice the difference. These students all work together and they appear to be on the same level, but I want you to notice that in one of these pictures, one student appears to be different, and this student is here. Team-based learning can have different formats. You can have team-based learning with teams working equally without a leader. Some teams decide to have a leader, and this leader usually stands. This is irrespective, however, of the role of the leader, because we do assume that all of you will become leaders in medicine. One of the things that I would like to point out, and one of the things that we have written even in the guidelines of professional bodies, such as the European Society of Cardiology, the European Resuscitation Council, the European Society of Internal Medicine, is what is the difference between a group and the team? And there is a huge difference between the group and the team. A group has a different goal. Each member of the group has a different goal, whereas the team has a common goal. We expect you to start as group, because that's how we all start, as uncoordinated people, and we expect you to proceed to become teams where your goal is actually the same. So the team members speak as one unit, whereas the group each member of the group has his own voice. We don't like groups in medicine, not because we don't like different opinions, but because we want you to start thinking in a collective and cohesive manner. And you may think that we have invented the wheel. The answer is that we have not invented the wheel. The team-based learning has started from management. And I'm not going to bore you, but in reality, this amazing book of the situated learning showed that significant improvement can occur in management if the people perform in teams because they share the same desire and proficiency in any subject. They've got mutual engagement because they are engaged in joint activities that promote collaboration. And finally, they use promotion of the same language. So it improves understanding. So it improves communication. So you can share experiences. So the other people can understand your problems and they can facilitate you in the process. And for healthcare education, the Academy of Medical Educators, which is the European Academy accrediting all medical educators, defined team-based learning as an instructional strategy based on procedures for developing high-performance learning teams that can dramatically enhance the quality of student learning. So, if I was to look at the keywords of this slide, the first word is the high performance. So what we expect from team-based learning and what the evidence has shown is that when universities employ team-based learning, we have high performance learning teams. And the other keyword here is that they can enhance each student individually. So it's not only the team who benefits, but it is also the individual student. And this leads to an improvement in your problem-solving skills because you may find it impossible, for example, to solve a case of a patient who has very bizarre symptoms and you may never have encountered such a thing before. But other members of your team may have ideas that will lead you to come to a solution. So it improves your problem-solving skills. It leads to a reduction of the teaching hours. And as the Dean has told you, our curriculum has less lecture hours than lab hours. And when I presented the first year program, you remember, there were just a few lectures and lots of labs. And finally, what I cannot describe, but you will have to see it happening in reality, is that inside the team, you develop team dynamics. So a type of energy is created inside the team. And this energy is enough to change your way of thinking. So, promotion of the teamwork enhances collaboration, team dynamics, and finally performance. And the final thing that we have seen and we have measured with the use of team-based learning, and it has been documented in the medical education literature, is that it promotes critical thinking. Remember, when I was speaking to you about the levels of learning, one on the top, we have the critical thinking, or what Maslow said, self-actualization. And self-actualization can be achieved through team-based learning. So in this way, the focus is shifted from the person who is speaking to you. You have time to explore, you have time to think, you have time to investigate, and you have time to invent. And this is what makes the doctors of tomorrow. So, the faculty members are no longer instructors. You are not passive recipients of the knowledge. We no longer consider the student to be what the Latins used to call tabula rasa, or a white piece of paper, where the instructor could go and write everything he really wanted. We now know that the instructor should be a facilitator. And a facilitator is someone who interacts with the teams. If you see the difference between teaching and facilitating in this slide, you will see that there are arrows from teaching going only from the teacher to the student. Whereas in the facilitating model of team-based learning, there is interaction between the team to the instructor and from the instructor. So, team-based learning emphasizes the three keys to effective active learning. One of the things that I have said in my first or the second talk, I think, was the fact that we want active learners. And who is an active learner? An active learner is someone who is taking responsibility for creating his own constructs of knowledge. And why is team-based learning enhancing effective active learning? Because it promotes group accountability. You have the opportunity to interact and as a result learn how to communicate and speak. And in reality, what we have seen happening here is that various in-depth discussions are developed within teams, and these discussions are then transferred to the rest of the class. And by embracing the idea of team-based learning, you become active learner. And you become an active learner by using experience, by using new ideas, but more importantly, you become what I am calling, and what the literature is calling, reflective practitioners. Reflective practitioners are practitioners who learn from their mistakes through a formal procedure of reflection. So, there is greatness in learning, and the Department of Medicine is here to help you achieve this greatness. Thank you.
Dear students, I'm Dr. Michalinos. I'm a lecturer of anatomy.
And I'm Dr. Tsvetanova. I'm a lecturer in pharmacology. Today we will try to give you some tips as to how to succeed in the first 3 years of medical school. We thought it was a good idea for us to get a little bit out of our element, and as a result, we will do it in a role play mode, where I will be uncomfortably the student for a little bit, Dr. Michalinos will be comfortably the professor, and then we'll reverse roles.
So,
hi, Dr. Michalinos.
Hello, Eva. You're here in medical school with all that stuff around us.
Yeah.
What do you want to ask me?
Well, first, how do I remember all of this? I heard you were lecturing in anatomy.
Correct.
And I got a little bit scared when I was thinking about how to remember all the different bones and muscles and joints that are in an arm or in a hand, and how will I ever be able to remember this and learn this?
If you try and do it at once, it's virtually impossible, no matter who you are, no matter what you do. But you're supposed to do it in parts. And actually, what means to learn? To learn means to understand. Those people that generated knowledge had something in their mind. For example, if I tell you that this is the colon, and if I tell you this is the ascending colon, and I tell you this is the transverse colon, obviously this is called ascending because it's supposed to go up, and this is called transverse because it's supposed to go across.
Okay.
And even if I don't tell you, it's expected that the continuation would be the descending, and so on. So learning is to understand.
All right. So
If you understand, eventually you will learn them.
so I shouldn't memorize everything.
Up to a point you have to memorize some things, but the percentage of memorization is very small when compared to the percentage of understanding.
Okay. And how would I? So the ascending, descending, this is very clear to me.
Everything is very clear in all
But-
practical sciences.
Oh, okay. But what about the brain? There's all kinds of regions that are not necessarily so intuitive.
Let's take it.
Cerebellum. What is a cerebellum?
Let's take it in a different way. Memorizing. There are also tips and tricks in memorizing. For example, do you see that nerve? This
Yeah.
is called the facial nerve. And
Okay.
it has 5 branches. Temporal, zygomatic, mandibular, buccal, cervical.
So this is where they end up, where they terminate.
Yes, but more
Okay.
importantly, you can put them in an acronym. 10 Zulus, bot, my, cat. Temporal, zygomatic, mandibular, buccal, cervical.
Then Zulu spot my cat. Well, that I won't forget that easily. So that's
No, you won't,
so mnemonics are always of help.
of course.
What about flashcards? I seen in movies that when people are studying for exams, they're flipping through flashcards. Is this
there
helpful
are
in your opinion?
There are all kinds of utilities. Those are here to assist. And in the university, usually you come in contact with everything. The professors will tell you tips, older classmates will tell you tips, sometimes friends from other universities will tell you tips. All in all, memorization is not something you're supposed to take a book and memorize. Understand, mnemonics, lectures, all those will help you reduce the amount of memorization to a minimum. But again, understanding is more important than memorizing, and memorizing has tips and tricks.
Okay. So now, what about all the labs that have experiments? What happens if I cannot do the experiment? If everything fails, will the professor penalize me for that?
First of all, I think experiment is termed experiment because it's supposed to fail, at least sometimes.
Okay.
Number one. Number two, you are a student, not a researcher. You are here to learn. Through learning, sometimes you will fail. It's expected, it's understandable. What is important, you don't have to write failure. You have to understand why you failed and then retry and do it again. As we say sometimes in medicine, try, fail, try again, fail better. Try again, fail even better.
Okay.
And so more, until you succeed.
So my professor will grade me more on how I understand what I was supposed to do rather than on the end result of whether it was successful or not?
Of course.
Okay.
Professor is here, you are not here to impress the professor. Professor is supposed to understand what you know.
Okay.
And if you show him that you know and you cannot hide from it, you have to really know, you have to really understand, there's no such thing as penalties.
All right. So what about presentations? I have horrible stage fright, and I don't think I will be able to handle to stand in front of an audience and present. And I heard that's part of the grading in some classes.
This sometimes can be hard, but actually it's hard when you go to people you don't know.
Okay.
In front of a class, in front of your classmates, in front of your friends that will be standing on the first row, it will be easier. Number one. Number two, again, there is the issue of understanding. If you have prepared your work well, it will be way easier. And number three, like the mnemonics, there are again tricks. For example, when I present, and I'm nervous until today, I never look at the eyes of the audience. I look above their head.
You're still nervous today?
Of course.
Oh, I thought people passed that at some point.
Bravery is not to feel fear. Bravery is to overpass your fear.
Okay. And in other classes, we are supposed to be in a team. And what happens if, I do all the work, seemingly, and one of my team members is partying all night? How do I approach that?
Welcome to adulthood.
Oh.
This is not school. In life, we have to cooperate with people. And sometimes we will be below the expectations. Sometimes we will have to do some of their work, but it's a group. You're not alone there, you're with the other group members. So you have to show maturity, and with the other group members, we have to suppose only one is the black sheep. Probably you will handle the issue internally. Sometimes this will not work. It doesn't always succeed. In this case, there will be always some instructor, some faculty member, some advisor, someone you will be able to talk to in confidentiality, and he will guide you through what you have to do.
I can go to one of the faculty members and not be labeled as the person that goes and tells all the negative things?
You will never be. You will never be because the faculty members understand. We have been in your position quite some times.
And all of that will be confidential? They were not going to turn around and tell my classmates?
Always.
Okay.
By the way, sometimes you will be the person that partied last night. You won't want the other ones to be strict with you.
Dr. Michalinos, I am a very serious person.
I was too before med school.
Ah, okay. Talking about that, how do you, college, we've been looking forward to it, parties and social life. How can you balance medical school that requires so much knowledge and learning and time, and actually having a life?
Be smart, be organized, reduce things you don't need. Sleep, for example. If you want to go all night and party, that's good, but you won't sleep in the morning, you will party in the night and go to school in the morning and reduce your sleep.
But then I'm not going to be productive. How am I going to absorb the information with a hangover?
You have to self-adjust.
Okay.
It's a sign of maturity to know when to party, how to party, when to go to school, when to be in your full strength, and sometimes when you can be even half asleep.
Okay. Thank you very much. I think these are all my questions so far. Hello, Diamanti. How are you today?
Hello, Dr. Svetanova. Thank you for meeting me. I have some questions to ask about some things I don't understand. And as you told me, I went to the library and brought my books. But the way I see it, best thing I can do with them is lift weights. I don't think I can study them.
There's so much information and knowledge in this.
That's the point.
Yeah.
Precisely. As I see it, this must be 1,000 pages, 2,000 pages, 3,000-4,000 pages, and I haven't counted. Taken all together, this is more than my last years in high school. And this is supposed to be the first year.
First semester.
Yes, first semester. What am I supposed to do with it?
Learn it.
And am I supposed to start book 1, page 1, page 2, and so on?
No. You are definitely not supposed to memorize this. Nobody can possibly memorize everything. But for every course, you will have a syllabus, you will have an order of the lectures, and your professor will cover 1 chapter or 2 chapters in any lecture. Follow his lecture, pay attention in class, see what he or she is telling you, then find it in the book. This might not be the biochemistry book that you choose to study from. There are another 100 biochemistry books. Check out this book. Of course, this is the most famous one, but read a little bit. Read a chapter from 1 or 2 or 3 different books. Find out which one speaks to you, which one is more understandable than you. Every writer writes in a different way. And find what is best for you. Use the graphics, the pictures. The pictures always help. They say 1,000 words. Read the part of the text, then try to understand what is in the picture. If you understand, then it will be okay. Then if you have a classmate with whom you're good friends, you study in a similar way. Try to teach them, try to explain the picture that you see. Try to explain the concept to your classmate. When you teach another person, that's when you really learn, and that will stick in your head. Memorizing this is definitely not advisable.
Okay, but nevertheless, I will have to be examined in this.
Yes.
Okay, let's take it otherwise. Now, what happens if, for example, my professor, when putting his subject, says, okay, page 447, let's ask about the interosseous sacroiliac ligament or whatever it is. I mean, a question has an answer, and the answer might be a tiny detail hidden here, 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 or here. How is it possible to find answers in such a vast amount, especially for exams?
Well, most of your professors are very fair. I would actually say that all of your professors are very fair. From time to time, something that you feel is a detail, they might think it's important. You need to pay attention in lecture, because if they spend a little bit more time on something in detail, even if it's only one line in a book, they thought that that detail is important. That's one. You need to prioritize. At the end of the day, if you miss one detail, that will be one question. Most of your exams are going to be multiple choice exams with 50 questions. That will be only 2% of that exam. And for example, the midterm exams in most classes, that's 30% of the grade. It's not that big of a loss. You cannot possibly learn absolutely everything. Know the basics, know a little bit more than the basics. Don't worry if you miss one detail. It will be only one question. Believe me, if you miss that question, you will not miss it again in the final, because you will know, I forgot to study this.
Okay, but speaking of lectures, now, the professors have prepared so many lectures. Some of them are good. Huh? Why do I have to deal with that? I can just take the lectures and study them. After all, especially in the exams, you're supposed to ask something you have told in class, correct?
Not necessarily. You're supposed to ask if it's biochemistry, and you need to be asking what's on the material of the biochemistry material. Everything is fair game that's in the book and in the lectures. You need to use as many sources as possible in order to grasp the subject. You will not know everything from day one, but it's a building blocks. You need the building blocks and the steps.
Yes, but...
Did I answer your question or no?
Yes, thank you. But you told that actually this is a book I know, this is Grey's Anatomy, but there are many other books. And when they gave us the course outline, there is a list of books downwards. Now, very recently I was a high school student. I took the books they gave me.
Yeah.
Now that there is a list of books, how am I supposed to choose? I have to study them and then choose?
I would take the same 2, 3, 4 books, however many books are suggested, and also ask students that have gone through the class from the higher years, like second years, third year students, what worked best for them, which book they found best. And then what I would do is take the same chapter and read it in 2 or 3 different books and identify which one is the best for me.
Okay.
Because sometimes one book might be very, very dense in terms of the information and written in a very convoluted way, and that might not be easy for you to read, but it might have fantastic pictures and graphics, so maybe you will need 2 books at the end.
Okay, I got it. That's something I can do. But as I have heard, medicine evolves. It is rewritten again and again. Actually, I have heard every 7 years or something. So, what's the point of studying biochemistry in my first year? When I will be in my 6th year, it will be totally changed.
Because it will not be totally changed. The basic concepts, especially what you study in biochemistry, in medical school biochemistry, this has been something that has been known for the past 30, 40, 50, even 100 and 200 years. Yes, it is true that every day, every week, every month, physicians and researchers come up with new ways to treat the disease or find new details about the cellular pathways behind something. However, these are the details. The building blocks, the general principles, they are usually the same. It is very, very rare that somebody finds something so groundbreaking that takes a chapter of this book and it essentially says it's not true. That would probably deserve a Nobel Prize.
Okay.
So you are likely to, whatever you learned here, in terms of the big picture, the major concepts, is going to stay. The little fine details, they will change with time, and it's up to you to essentially spend your entire life, even after you have become a medical doctor, keeping up with the new information.
Okay.
You're a student, you signed up to be a student for the rest of your life by choosing this career.
I have another question. When I was in high school, we had to go to the school in the morning and study in the afternoon.
Okay.
Actually, I didn't like it, but I had to wake up early in the morning. I think I study better at nights, and now I can wake up earlier because we have lectures after 12 o'clock. Is that okay, or is it somehow not normal? I mean, I like to study after 12 o'clock. I'm productive then. Is that okay, or is it a problem?
It all depends on what is best for you. What works for you might not work for me. You need to identify and test, and the quicker you find out what is the most productive time for you, the better, because you won't waste time. It doesn't matter if you study for an entire day and you absorbed only 5% of what you studied. If there is a particular period in that day, 3 hours, that you study and you absorb 80% of what you learned, choose those 3 hours to study. Make sure that you always study in those 3 hours. And do not study in the less productive times. But that is very individually based.
Okay, and a final question, which might be sensitive since you are a pharmacologist. Now, sorry to tell you that, but I know what I'll do. My parents are both dermatologists. I will become dermatology. I have seen them in the lab. I know they know pharmacology, I see that they know, but I don't really see them using many drugs. Why am I supposed to learn pharmacology and not focus on things that are relevant to dermatology?
Okay. 1, pharmacology is the most important subject. No, that's just my personal opinion. Now, to be more serious, first, just because your parents are dermatologists doesn't mean you will become one. You will see as you go through medical school that there are different disciplines and specialties that will fall in and out of favor for you with time. You will get intrigued by something, and don't be surprised if you end up being something, some other specialty from your parents. That's one. Second of all, as a dermatologist, you might find one of your patients might have diabetes. Another patient might have heart disease, or all kinds of other ailments. All these patients usually take some kind of medications for their primary ailment. You need to understand how these medications work so that the creams and the medications that you prescribe do not jeopardize the overall treatment of the patients. Drugs, different drugs, they interact with each other, sometimes in a positive way, sometimes in a very detrimental way. You do not want to be the medical doctor that ends up making your patient feel worse just because you prescribed the wrong something that's not compatible to what he's already taking or she.
Thank you very much, Dr. Zvetanova.